back. This is the Daily Report. Walter Juma is on sign language docket. I'm used to Stanley Nyeringita. Ladies and gentlemen, this particular evening we dive into the conversation of matters, the humanitarian crisis in Sudan. It has been 2 years of civil war, and right here with us, he's been with us just before the break, John Riaga. He's a media manager at MSF Eastern Africa, just giving us a glimpse of how it has been this particular 2 years. And just before we went on a break, you're on the brink of telling us the disease outbreak in that particular country. In the 2 years, have you, as doctors, have you noticed certain diseases, cropping up and a resurgence of these particular diseases?
Yeah, like I mentioned before the break, even before April 2023, MSF was already working in Sudan just to make sure that medical services are able to reach everyone that actually, needed the medical services. And in that nature, you would expect that there would be a predisposition to certain diseases. The diseases that can easily be taken care of when the health systems are okay, would then easily, come and affect that kind of community. So what we are seeing now is because there are people who have moved to IDP camps. Yes. So what happens in those IDP camps, they are actually crowded. And when they are crowded, then when diseases break out, like measles, for instance, it spreads very fast. And I was mentioning just before the break that we are getting into the rainy season. Yes. And what we are seeing is a possibility of an upsurge in malaria, infections. We are looking at cholera, a surge in outbreak of cholera, and we are already seeing, even in Tawila that I was speaking, severe acute malnutrition in children. So what we are saying is the situation in Sudan as it is right now has predisposed the populations to diseases that would otherwise be easily controlled. Mm-hmm. Yeah. And
one burning question that most people definitely have is, for 2 years, why has this war, in your view, persisted for this particular 2 years? What factors are playing out as someone who has traversed this particular country and even talked to the people there?
I would not say, with a lot of authority, why the two factions are in conflict in Sudan. And I think we have seen, based on, the meetings that have taken place in several parts of the world, people just trying to put their heads together to look at that. So there are a number of things that, as an organization, we say we are not going to get ourselves involved in. There are people who are pushing that agenda, and our only hope is that when they push that agenda, that it's sorted as fast as possible, so that the people of Sudan can, go back to at least some level of, equilibrium, some level of life, that they're able to move from one place to another, that they're able to walk into a medical facility when they are unwell to get treated. And that's why our cry is, in as much as there are other players that are pushing, the other agenda, what we are saying is, while that is going on, we hope that it ends soon. But while that is going on, can the people of Sudan be given an opportunity to access medical care, be given an opportunity to access humanitarian aid, be given, even us as we move around Sudan, can we be given an opportunity to move and, facilitate movement of medical equipment and medical personnel inside Sudan.
Right. A number of these particular refugees, and as the United Nations mentions, about 3.3 million refugees who have fled to neighboring countries. And some of these neighboring countries, majority of them include Chad and South Sudan. A majority of these refugees getting into these two countries. But then, as Kenyans, as we are looking at this particular conversation, in the long run, should we be worried about the impact of refugees even flocking into the country, into Kenya, and what kind of humanitarian crisis are we looking at in the long run?
We do not have data of people who have fled the war in Sudan into Kenya, for instance. But we know for a fact that Medecins Sans Frontières, we have IDP camps where we offer medical services in the country of Chad, in the country of South Sudan. And these two countries actually have majority of refugees or people who have fled the war, the conflict in Sudan. But there are few others who left Sudan through countries like Egypt, Ethiopia, and those others. But what we are saying is, because we are neighbors.
Yes.
The proximity between Kenya and Sudan is very clear. And when we speak about disease outbreaks, when we are not able to control, when this humanitarian, a crisis spills over to levels that are unimaginable, Kenya, of course, somebody somewhere will have to sit down and say, wait, this thing that is going on in Sudan really needs, attention. And that's why we are saying, can everybody just stop what they are doing and focus on Sudan and say, what's going on in Sudan? We really need to stop what is going on in Sudan, at least for the people of Sudan.
Now, Mr. Riaga, before we wrap it up, just to really understand these particular numbers, 3.3 million refugees, that means there are quite a number of IDP camps. As MSF, how many do you know of that are around that particular country, either in Chad, South Sudan, and even in Sudan?
There are a number. I may not give you, the exact figures, but there are a number. So we have IDP camps where, people come in and settle, but we also have what we call transition camps, where then they are processed when they get into another country. The preliminary things, and then they are processed and they move to so like in Sudan, you'll find there's more than one. In Chad, you'll find there's probably more than one. But what we are saying that there are several IDP camps, depending on what parts of the borders between those countries and Sudan that people are able to use to escape the conflict. Right.
Your closing remarks, what kind of impact are you hoping, and also the success stories? I mean, might not be all gloom, as Doctors Without Borders. In the 2 years, do you see any impact that you have caused, that you actually come back and say, well, we did help here and here and here, as your closing remarks?
Yes, there's a lot that has been done. I was mentioning earlier, we've had, for instance, 80 incidents of attacks targeting medical facility and humanitarian aid workers. And we have people, we have staff who have endured all this. And they are saying that they just need to be given an opportunity to offer medical services. And this is what we are witnessing on the ground, that people actually need these medical services. People are suffering from diseases that they should not suffer from. And what we are saying is, if given an opportunity and given, free way to move equipment, to move supplies and even staff, at least we will get to a point, because we have seen it, we'll get to a point that even as the other things are sorted, people at least have the basics that they need in Sudan.
Thank you very much, John Riaga. He's the media manager at MSF Eastern Africa, giving us a glimpse of the humanitarian crisis in Sudan. Ladies and gentlemen, we